So next is floor or the rhomboidal fossa. I'm not writing anything. I'm going to explain this diagram. Okay, so this is the diagram floor where it lies. Okay, the floor part, the upper part, upper 1/3 or the upper triangular part is formed is behind the posterior surface of pons. Okay, posterior surface of pons, and the lower part is formed by the upper part of the medulla. Okay, so the lower triangular part is formed by the upper part of the medulla, and upper part is formed by the posterior surface of pons. Now what are the parts, or what are we can see in this? Okay, first of all, the rhomboidal fossa is this rhomboidal fossa or the floor is divided into two parts by a median sulcus. This is the sulcus. Okay, it divides the two parts. If you will keep your Vishram Singh book along with it, you will be able to understand it much better. Okay, and then comes sulcus limitans and medial eminence. On the lateral sides of these median sulcus, there is some longitudinal circle eminence is there. This elevation is there, that is called medial eminence. That elevation is called medial eminence. And then lateral to that side, we can see boundary that is called sulcus limitans. Okay, another boundary that is we can call it as sulcus limitans. And as we go above the sulcus limitans, we see a dark color area, darkened area. Okay, it's like a tip, it's like a pit, like a depression. Okay, that is called superior fovea. And as we go down, we can see another depression which is called inferior fovea. Okay, which is called inferior fovea. When we go above, when we trace the sulcus limitans and we go above, we see superior fovea. When we go down, we see inferior fovea. And just above this superior fovea, what we can see is a bluish color pigmented area which is called locus ceruleus. What is it called? Locus ceruleus. What is there? There is pigments. Melanin pigment is there, and that containing pigment is called substantia ferruginea. Substantia ferruginea. It contains neurons which has norepinephrine, and also melanin is immensely there. Okay, so now this is these are the medial eminence. Now this medial eminence, how it is formed? This medial eminence is formed by the neurobiotaxis. If you have learned neurobiotaxis, you would have learned that there the facial colliculus migration occurs, facial nerves migration occurs such that it forms a elevation above the pons, and that facial colliculus over the abducens nerve forms this elevation that is called medial eminence. What is it called? Medial eminence. And as we go down, we can see below stria medullaris, this is stria medullaris. Okay, below stria medullaris, which is lying just below the medial eminence, below that we can see a triangle that is called hypoglossal triangle. Below hypoglossal triangle we can see vagal triangle. Okay, and this vagal triangle is divided into two parts by funiculus separations. Okay, it is separated by two parts by funiculus separations, and the lower part is called area postrema. It is the place where blood brain barrier is absent, and it is the emetic center. And below that it is obex. The obex is like the pen like pointing structure which is present. We have seen ink pens, so it looks like an ink pen. That pointed structure part is called obex. Okay, funiculus separations is over, vagal triangle is over, hypoglossal triangle is over. Okay, now this is inferior brachium, and yeah, superiorly it is bounded by superior cerebellar peduncle. And then this is tinea. Tinea is a space, narrow white ridge which is coming from the inferior lateral margin, and as we go down it forms the obex. So this tinea, it's like the white margin, there's nothing present here, it is space, it is a space. So as we go down, we can see this obex which is like a pen structure. So this tinea forms the obex as we in the below part. And then inferior cerebellar peduncle, this is tuberculum cinereum, which is a slight elevation in the lateral aspect of inferior cerebral peduncle. Then this is gracile tubercle and cuneate tubercle, which is respectively formed by nucleus gracilis and nucleus cuneatus. And from here the pyramidal tract arises, or a pyramidal tract, they pass, the fibers pass through this gracile tubercle and cuneate tubercle. So this is the floor of rhomboidal fossa. Whatever I have spoke for the last 5 minutes, past 5 minutes, you need to write that, and you need to draw and label it, and the writing part would constitute almost like of half page or 3/4 of page. And then what you have here is floor, and I have just explained it along with the diagram, so you will be writing that also for half page. And then you have fourth ventricle recesses. So all of this constitute, and this can be asked as a short essay. Okay, short essay. So 3-4 pages along with diagrams for fourth ventricle and short essay. These are the important points which you need to write for short essay. That's it. So this is the fourth ventricle, and I don't know what I'll be starting next, but thank you for watching.